One man he goes under the knife to forever banish his good old beer belly. That's coming up.
The Columbia Space. My health team partner Alicia Booth has a look at what one local surgeon did to change the life of a Cleveland man who was tired of his gut.
You know it when you see it, the unmistakable beer belly. It's a problem Cleveland doctors like Mark Foglietti see all the time.
They have normal-sized legs, normal-sized trunk and arms, and they've got either that basketball deformity or the watermelon deformity right in the belly.
Though even Dr. Foglietti calls that deformity a beer belly, you don't lose your six-pack abs because of the six-pack you drink. It's more like what you buy to go with it that's the problem.
It's not from drinking beer, it's from calories, and we refer to the whole beer belly thing because beer is high in calories. But it is just fat deposition.
And as a plastic surgeon, Dr. Foglietti decided it was time to do something about it. Enter Alan Goodwin, the ideal patient who has lost his patience with his beer belly. He never used to have one, but as the years passed and his metabolism slowed, it grew and grew, no matter how much he worked out. Alan agreed to be one of the first male patients on record to have cosmetic surgery to remove his belly.
I might as well get it done while I'm still healthy and I can afford to do it.
As a diabetic who's already had heart surgery, he knew the extra fat was putting him at risk. But that's not his only motivation.
I'm a 56-year-old male, single guy, and I like ladies, and I have to say that's certainly the other benefit.
Dr. Foglietti knew exactly what he had to do.
The only way to really correct that is to go inside the abdomen, remove that fatty tissue, and then tighten the muscles.
Like most men with his problem, Alan's gut was very resistant to diet and exercise. And men's fat is hard to get at. It grows under the muscles, thinning them and stretching them way out. Dr. Foglietti, with the help of a general surgeon, is removing the fat and repairing the muscles so they'll have a chance to tighten back up.
Alan's internal fat weighed 990 grams. That is equivalent to 2 double D breasts.
The doctor says Alan's stomach will continue to flatten for a full year, but here are the results 3 months after surgery. Alan before the 6-hour operation, and Alan after, about 20 pounds lighter with 4.5 inches off his waist.
It was worth all the pain because I knew I was going to look good and feel good the rest of my adult life.
Alan's back in the gym now, enjoying exercise more than ever.
One of the best decisions I've ever made. My lungs are freer. I just have more movement in my body. I'm flexible.
He knows the surgery is just the beginning, that it's up to him to keep exercising and watching what he eats if he wants to continue to see a return on his $15,000 investment.
Worth every dime. It was worth millions. You can't put a dollar amount on health.
Alicia Booth, News Channel 5.
And Dr. Foglietti has some common sense advice for men who find themselves developing their own beer belly. Watch your diet and be sure to exercise, because once you have that belly, it is very difficult to get rid of it.
All of us have to learn how to use these muscles more.
That's right. Push away from the table.